So what is the clinical manifestations of hypertension? So we know that hypertension is a long-term medical condition in which yung blood pressure in arteries is persistently elevated. Symptoms of dizziness and unsteadiness is an indicator for early warning signs of a stroke caused by high blood pressure. Yung symptoms na to is maybe due to lack of oxygen supply to the brain. Another one is headache. Headache is a pulsating sensation, pressures in the cranium na nabibuild siya as a result of a blood pressure increased or suddenly spiking up to a critical level. So it is an indicator na yung mga arteries or blood vessels niya sa brain which is too small at pwede siya mag-cause ng increased vasoconstriction and pressure resulting for this manifestation. Blurred vision and retinopathy is also called as hypertensive retinopathy. Yung mga tiny vessels natin or blood vessels in the back of our eyes can even bleed because of the pressure, and this can lead to blurry vision. So chest pain is an indication that there is vasoconstriction, obstructions, or insufficient oxygen supply into the myocardium. Nose bleeding or epistaxis, it is possible that hypertension causes arteriosclerotic nasal vascular changes that may predispose to increase susceptibility to epistaxis. Another one is yung hematuria or presence of blood in the urine. Usually, if you will be assigned in the ER, for the patients with malignant hypertension, this is common. During catheterization, you will notice na bloody yung urine output niya sa bag. So this is very important, an indicator that needs to be assessed, and it will help us to provide more clinical eye, and it will help us a lot in how we're going to help our client. So hello mga ka-Berks, your nurse on duty is back for another topic, and this is very essential for caring our client. So stay with me. Please like naman and subscribe my channel. We're going to discuss more on hypertension. Ang American Heart Association may tinatawag silang blood pressure categories. Ang normal range ng blood pressure natin is 120/80 mm mercury or less. So, meron tayong tinatawag na baseline. Ang ibang tao kasi, ang normal BP niya lang is 100/80, 90/60, 110/70. Yun yung kanilang normal blood pressure. So that is what we call the baseline. So if you're going to assess the patients with hypertension, 30 mm mercury above the baseline could considered as hypertension. Example, 90 lang siya. Kung 30 mm mercury, that is 120/80 is pwede na siyang maklasify sa kanya na mayroon siya hypertension. Kasi yung baseline niya. So, another one is elevated systolic between 120 to 129 and diastolic less than 80 mm mercury. Yung stage 1 naman ng hypertension, yung systolic between 130 to 139 or diastolic between 80 to 89 mm mercury. Stage 2, systolic at least 140 or diastolic of at least 90 mm mercury. Hypertensive crisis, yung systolic over 180 and or diastolic over 120 mm mercury. Usually, this is very common sa mga patients na mayroong malignant hypertension or patients with renal problem. So, ito yung type ng crisis or hypertension na hindi basta nag-i-effect ang mga medication. There are two factors that regulate the blood pressure: total peripheral resistance, or known also as systemic vascular resistance or SVR. So, ano yung ginagamit yung SBR or TPR? These are the vascular resistance used in calculations of blood pressure, blood flow, and cardiac function. How about yung cardiac output? Yung cardiac output naman can be determined to calculation ng heart rate times 70 ml. Yung 70 ml is constant yun na. That is the amount that can be pushed by the left ventricle. So, every contractions of the left ventricle, that what is yung tinatawag natin na cardiac output. Yung cardiac output, kinukompute kung yung ilan po yung heart rate mo for the 1 minute, let's say 80 times 70 ml. That is our normal cardiac output or stroke volume. So, yung arterial blood pressure is determined by the cardiac output and increased resistance to blood flow. The key word that we always look for patients with hypertension, unless it is a secondary hypertension, is the word vasoconstriction. So, mayroong tinatawag na systolic pressure. So, BP na 120 over 80, ang systolic niyan is yung 120. It means that is achieved by contracting left ventricles in junctions of its stroke volume. So, yung systolic pressure is the pressure coming from the left ventricle going to the arteries. Okay? Yan yung systolic pressure. Why it is systolic pressure? Because the arteries is carrying the oxygenated blood. Pero in between ng diastolic and systolic pressure, kasi yung kung sa BP na 120 over 80, the diastolic pressure is the 80, which is the continuous forwarded of blood in the capillary system. Ito yung, sa diastolic pressure, ito yung shifting from the higher or high concentration or pressure into a lower pressure para magkaroon ng diffusion or exchange between carbon dioxide and oxygen. So, mag-shift sila. So, dapat mababa yung pressure. In between that, may tinatawag tayo ng pulse pressure. The difference between systolic and diastolic. What is the use of this pulse pressure? This is used to assess yung BP. Yung systolic pressure of 120 minus 80 equals to 40 mm mercury. That is the pulse pressure. So, para saan tong pulse pressure? Example, pag yung pulse pressure is mababa, example, 25 mm mercury, this is an example of patients with problem in congestive heart failure resulting for the low stroke volume. Kakaunti ang lumalabas, although yung patients could have tachycardia, pero ang stroke volume niya or cardiac output niya is less. So, nagkakaroon ng retention ng fluid in the circulation. Pag narrow yung pulse pressure, pwede rin yung may aortic valve stenosis or cardiac tamponade. Example ng trauma, pag low and narrow naman yung pressure niya, it may suggest that significant blood loss. So, resulting ng insufficient blood or preload leading to reduce yung cardiac output. Kasi, as we know na yung systolic and diastolic pressure, it indicates kasi ng systolic, siya yung highest arterial pressure each heartbeat, while yung diastolic pressure naman is the lowest arterial pressure occurring in each heartbeat. So, ito yung systolic and diastolic. Normal range is 40 to 60 mm with a low pressure of 120 systolic pressure and 80 as diastolic pressure. How we're going to test or check for these abnormalities? It is normal yung BP monitoring, that is also basic, na para malaman ng patients kung mayroon siyang hypertension, kailangan nating i-BP. And again, from the previous slides, we know what is the importance of BP monitoring. Next is the laboratory using the urine or urinalysis. Checking for the presence of protein, it indicates that there is sugar. This is common for the patients with diabetes. RBC, presence of blood in the urine, indicates also for renal problem, and WBC indicates for an infection. So, sunod po is the serum potassium. Serum potassium is being assessed na dapat less than 3.5 millimeter equivalent, it may indicate kasi yung adrenal dysfunctions or primary hyperaldosteronism. Next is the BUN, or the blood urea nitrogen. Levels that are elevated more than 20 millimeters, serum creatinine levels, na pag nag-elevate yun ng more than 1.5 milligrams, it suggests renal disease. Next is the common na makikita natin if there is a problem in the heart, yung ECG. Usually, pag may patients na may hypertension, it shows the left ventricular hypertrophy or presence of ischemia. And it is also validated through X-ray kasi mayroon siyang cardiomegaly. Cardiomegaly means there is an increase in size or malaki yung heart sa X-ray. So this will help us to assess and check on the manifestation of hypertension. So how it happens? Usually, nangyayari ito pag yung expected na sa family history, yung father, yung mother, merong history na nagkaroon ng hypertension, possible siya for genetic problem. Another one is obesity and unhealthy foods, eating unhealthy foods containing more fats that may result for more plaques that nadideposit siya sa ating arteries and veins, and of course high salt intake or sodium, which attract or absorb more water, resulting for hypertension. Another one is the excessive smoking or presence of nicotine, resulting for the viscosity of the blood in the circulation, nagkukause siya ng blood coagulation. Also, using of contraceptives. Bakit po yung gumagamit ng mga contraceptive pills nagkakause ng hypertension? That is the adverse reactions of the medications because of the presence of the estrogen. Kasi yung estrogen, nag-i-stimulate siya ng hepatic productions of the renin. Renin na nagsusubstrate naman ng angiotensin. Remember, pag na-convert yung angiotensin 1 to 2, that is also a vasoconstrictor. And of course, excessive alcohol consumption. Too much alcohol can leads to more problem. Primary preventions is the opposite of the previous slide's presentation. So kung mas mataas yung saturated fats mo sa diet at sodium intake, we need to moderate or decrease the saturated fats and sodium intake. Cessation of cigarette smoking para malimit yung presence ng nicotine sa katawan. And of course, moderations and consumptions of alcohol, regular pattern of exercise, and stress reduction is very important because when we're exposed in stress in a long period of time, nagkukause siya ng vasoconstriction resulting for heart problem, hypertension, and other pathologic disorder. Same with the maintenance of ideal body weight. Classifications of hypertension. Number 1 is essential idiopathic and primary hypertension. This is the type of hypertension na ang cause lang could be through genetic or could be aging or lifestyle. Okay. Next is the secondary hypertension caused by another disease. Ibig sabihin, that is a secondary complication. Meaning to say, example, a good example ng hypertension is yung may mga congestive heart failure, yung may mga peripheral vascular disease, and yung may malignant hypertension naman is severe rapid progressive elevation ng BP that cause rapid onset of an organ complication. One good example dito sa malignant hypertension, yung patients with renal problems or renal failure. Talagang BP niya is 180 over 110 or 120, 220 over, let's say, 140. So that is malignant hypertension, but classified as also a secondary because it may cause by another disease. Yung labile hypertension is the intermittently elevated na ang BP niya. Mayroon tayong tinatawag na white coat hypertension, elevation ng BP only during the clinic visit. Na pag nasa bahay pig BP, okay ang BP, or pag nasa ibang lugar, tapos binipi mo siya, normal ang BP niya. But during consultation, laging mataas yung BP. And hypertensive crisis, this is the situation that requires immediate lowering of BP. Because ito yung klase ng mga pasyente na kahit umiinom sila ng gamot, hindi bumababa yung BP. Renin-Angiotensin-Aldosterone System. So, paano tumutulong yung Renin-Angiotensin-Aldosterone System in managing the pulse or the blood pressure inside the system? Pag mababa ang BP, magpo-provide ng stimulus sa liver para mag-secrete ng renin. Pag na-secrete ang renin, ang liver ay magpo-form ng angiotensin 1 made by a plasma protein. Pag na-form yung angiotensin 1, ito naman angiotensin converting enzyme in the pulmonary bed will convert this angiotensin 1 into a potent vasoconstrictor known as angiotensin 2. So, pag may angiotensin 2 na, it is expected na tataas yung BP kasi dahil nga ito is a potent vasoconstrictor. So, may tatlong organ na affected. Yung brain, yung heart, and also the circulatory system, the arterioles, and the vein, and of course, yung kidney. So, anong mangyayari? Mayroon na siyang vasoconstriction of systemic arterioles. So, anong gagawin ng adrenal cortex? Magre-release, stimulate ng adrenal cortex ang aldosterone, at pag na-release yung aldosterone, it may leads to sodium and water retention. Of course, pag may sodium and water retention, it needs to be absorbed ang sodium, at usually, ang mangyayari since sodium attracts more water, mag-i-increase ang volume of water in the kidney. So, ang kidney is the one also providing or maintaining the blood pressure, since dapat, di ba, pag nagbigay ka ng medication sa patient, just after 15 minutes, ilang minutes, you monitor but still mataas yung BP, you need to ask the patient kung nag-urinate na siya. Kasi kung hindi pa siya nag-urinate, mapapansin mo hindi siya bumababa. So, pag nag-urinate na yung patient, that is the time that you will notice na bumababa na yung blood pressure. So, that is how the Renin-Angiotensin-Aldosterone System works in hypertension. Late complication. One of the late complications is retinopathy or hypertensive retinopathy that may lead to blindness. Another one is the arrhythmias. These arrhythmias could be tachycardic or bradycardic because the heart is trying to compensate based on the demand of the system. Hypertensive encephalopathy, could be leading for stroke. As we discussed before, there are three main organs na affected by hypertension: the brain, the heart. Example is angina and myocardial infarctions that could be leading to heart failure. And of course, renal failure, which the kidney is the one responsible for maintaining also the blood pressure in the system. Let's talk about the pharmacologic control of hypertension. Napakaraming medications na prescribe sa patients na may hypertension. Step 1, diuretics. Diuretics is the first line of drugs that is being given to treat yung mga mild hypertension. So the actions of diuretic is to promote sodium and water excretion. Pero napakarami kasi ng klase ng diuretic. Mayroong potassium wasting diuretics like thiazide na nagpo-promote ng sodium chloride, potassium, and water excretion. So yung patient, since these are more on the electrolytes, pwede siyang magkaroon ng hypokalemia. So, ang example naman yung loop diuretics, ini-inhibit niya yung release of water in potassium chloride and magnesium. So, next is the beta blockers. Beta blockers decrease the cardiac output by diminishing the CNS response. So, what will happen? Magdi-decrease yung BP and diminishing the vascular constriction and renin release. So, ang mangyayari, instead na nagtatachycardia yung patient, nagkakaroon siya ng slow cardiac rate and contractility. Yung calcium channel blockers naman is decreasing the calcium release and promote more vasodilation. Pag tinawag naman natin na direct-acting vasodilator, it relaxes the smooth muscles of the blood vessels, in particular the arteries, resulting for vasodilation. Yung adrenergic neuron blockers, this is more focusing on the peripheral acting sympatholetics. So it blocks the neuron release for the CNS that results in the lowering ng BP, and both decrease yung heart and peripheral resistance. So these are the type of medication that usually prescribed sa mga pasyenteng may hypertension in combinations of different steps. Nursing intervention. We need to teach our patients about the risk factor, and we need to encourage on some therapy like stress therapy, music therapy, exercise, walking, that will help to sustain and maintain a healthy body. You need to avoid stimulant like a cigarette because it contains caffeine. Encourage more healthy foods that are low in sodium and low saturated fat diet. Avoid alcohol and avoid coffee that are rich in caffeine like Coca-Cola and chocolates. Then we need to observe weight reduction if obese. Teach about the medication and some things that it needs to be avoid. Avoid yung prolonged and sitting standing kasi nagko-cause ng sluggish circulation ng blood leading for more viscosity. We need to inform also that most side effect ng antihypertensive drug is potassium depletion and postural hypotension. Yung potassium is an electrolyte which is very important in the contractions of the heart. So, pag nag-deplete siya, magkukause siya ng arrhythmias. Postural hypotension is the adverse reaction na nagko-complain yung patients ng dizziness, especially after a few minutes na uminom ng antihypertensive drug. Take meds at regular basis. Usually, it is being prescribed na it needs to be taken in the morning after breakfast. Avoid very warm bath, especially for those patients na mayroong symptoms of ischemia. Avoid thiamine-rich food, which is very high in fats and sodium. Alcoholic beverages that may lead to a hypertension, and we need to discourage abrupt withdrawal of medication because we're trying to prevent the rebound hypertension. So this is very important, and we need to make it clear to the client why we need to follow this one. Thanks for watching. Please don't forget to subscribe and hit the notification bell so that you will be notified on my next topic. I'm your nurse on duty, signing off.